Today we're going to be doing a Botox injection, and Botox is a muscle relaxer. So you don't need to be afraid when you see people walking around that look weird. It's probably not because of Botox. It's when they're nice and smooth that is because of Botox, because Botox prevents your muscles from moving. However, you can still look natural. So I have got Botox in my crow's feet, in my glabellar lines, so this is as much as I can furrow at you, and then in my forehead. But anyway, so today we're going to be doing a typical Botox injection. So we're going to start with crow's feet. So I'm going to just swipe over here, and there's a muscle that goes right around your eyes, and so we're going to relax that so he won't have the squinty lines anymore for at least 3 to 4 months. Are you ready? 1, 2, 3, here we go. So this is a typical place to get injected, as is between the eyebrows and in the forehead. We do a lot of masseter injections too in case you have TMJ or grind. You can use Botox for something called hyperhidrosis, which is excessive sweating in the armpits. So there's lots of great reasons to use Botox. So we're going to go to this side. 1, 2, 3. You're doing great. And lower. Does it hurt? And so Botox will kick in anywhere between 3 to 4 days, up to 2 full weeks. So I always have my, especially first-time patients, come back in about 2 weeks just so we can make sure it looks perfect. So that was the crow's feet, and now we're going to go in between the eyebrows, and I marked them with my special pencil. Okay, turn to me. Excellent. Okay, I'm going to start over your right eyebrow. 1, 2, 3. Here we go. And depending on how strong your muscles are, tells us how much we're going to use. Typically between the eyebrows is 20 units. But you can do 40 units. You can do more. It really just depends on how strong your muscles are. And the more you do it, perhaps the less you may need over the years. 1, 2, 3. Because your muscles can atrophy and they become less strong, so that's great for lines. Sometimes people have really deep lines between their eyebrows, almost like scars. We don't here, but sometimes people do, and Botox isn't going to get rid of that, but it will help make that deep line less, it will help make it, it's more preventative. It will stop it from making it worse. So sometimes we need to add something like PDO threads to help with that line if it is really deep. But if you look at your parents and your parents have deep lines between their eyebrows, it's best to start early with Botox to help prevent you from getting that deep line too. So it can be preventative, and it also can be treatment. So, and that is a typical injection. So if you want to find out more about Botox and find out if it's right for you, or find out about any of our other 55 plus procedures at RejuvenationMD, find us online at RejuvenationMDMedSpa.com.